point that even if we try to sort of opening up the lockdown, they still need to be somehow protected because they remain vulnerable. And that goes with people with comorbidities like diabetic. I just pick up in one of the studies that more diabetic persons actually die than those that have got higher blood pressure and other comorbidities. But that's just one of those. So we need to protect them. Pregnant mothers, we need to protect them. All of those, I think the protective effect will be a little bit longer, even if we pass through the pandemic and just have sporadic cases or so. We still have to take care of them because they remain vulnerable.
Thank you. Would you like to add to that, Mr. Makumbi?
Yes, like I said, the number of tests and our capacity is driven by or is initiated by the ministry. Once these people are identified who are vulnerable, who needs to be given the priority, we should be able to come in and say we are able to test. Depending on the numbers of the people identified, we have the capacity, like I said. For now, for example, each laboratory all over, we have about 39 labs. We have triple packaging material for each lab, which is ready to come in and receive a test. For now, we are testing centrally and ship the specimens to Windhoek. Until that time when we say, okay, maybe we should roll out and decentralize testing, then we should be able to test on site as well.
Dr. Bernard and perhaps Dr. Mata as well, we hope not, but there is a real possibility that there has been some infections within the community, local infections. If that is the case, and after the 2-week window period, it emerges that they're displaying these symptoms, what do you do? What do we do as a nation? What happens then?
I don't know if you want to answer this epidemiology, but you know, the situation is unfolding, and we don't really know what will happen next week or the week after. All we know is the biological behaving and a whole lot of data about the virus that we pick up, but how it will play it ourselves here in Namibia, we're not sure. We only know the little bit that we have covered so far. So all our strategies and action will depend on what are the data telling us at that point in time. But we are ready to face any eventuality. Maybe not entirely ready, I must qualify my statement, but we are closely monitoring. It's almost like watching a drama on stage. We will check what phase of the virus is actually playing it out. And based on that, we move on the virus. But on more epidemiological data, I think Dr. Mata can give us. He's a specialist in that field.
Okay, so all that we should do now, of course, whether we are suspecting, of course, that is the fair, approach, because if you are not suspecting that you might be having a community transmission, you will just relax. So, but what we should do is I'm happy that the lockdown is going to take effect. We should really try by all means to prevent community transmission if it didn't happen yet. But of course, in case we will have evidence that we have many cases that are not linked to those imported and clusters that we already know, and then we reach a situation and description and conclusion that we have community transmission, then we have to make sure that we are reducing the number of cases. We are making efforts to slow the transmission, and we have to redouble efforts to contain and stop that community transmission. Otherwise, if we don't take a resolve and make sure that we stop it, it will finish most of the population. So this is how serious it is. So let's try by all means, if we don't have it now, the community transmission, let's prevent it at any cost. And then once maybe for one or other reason it is really with us, let's try by all means to stop it as soon as possible.
Thank you. I am going to invite the journalists that are here to ask questions. So can I get the first, any questions? Yes, can you come up to that mic and introduce yourself, please?
Good afternoon. My name is Selima Henok from the NBC. My first question is to Dr. Haufiku. I just wanted to find out if perhaps you have a time frame as to when the mass testing will start in terms of maybe getting more people to be tested of COVID-19. Is there perhaps a time frame as to when it will start during this time of state of emergency? And also then my other question is to Dr. Bonnie. Yes, it's to Mr. Bonnie. I just wanted to find out if how many cases, confirmed cases, that we have now of COVID-19 in Namibia were tested through NIP. Thank you.
Thank you. Go ahead.
Did you say the time limit for testing?
Yes, I just wanted to find out when
Come take it.
the mass testing for a lot of individuals, just to confirm if we still have, like you mentioned earlier, in terms of cases, just to find out if we have more cases of COVID-19 in Namibia, besides from the 16 that we have now.
So,
Is there a plan, a strategy as to when that will start?
Yeah. No, thanks very much. I just mentioned that we started the active surveillance. This is part of the strategy to check if community transmission is taking place or any other information that may guide us, our strategy going forward, basically. So we're hoping that in the next 2 to 3 weeks, we will be somewhere halfway already in that process. And it will be an ongoing process because we need data from that to guide our decision and our recommendation to decision makers, like policy decision makers, like cabinet, etc. So it's an ongoing process, but we are almost midway. Hopefully in the next maybe week, 2 weeks or so, we will do more, we will have more result of testing. It may not be that enough, but we'll keep on pushing so that we meet epidemiological criteria of data that will help us make informed decisions. So it's an ongoing process.
And yes? The second part of your question was to...
The other one is yours, I think.
I just wanted to find out how many cases that we have now of COVID-19 in Namibia were tested through the NIP.
Yeah.
Yes, there's a total of 16 positives in the country. The first 2, of course, that time were not ready. They were tested by NICD in South Africa, the National Health Laboratories. And subsequently, we started testing locally. And we have inter-referral between us and PASCE. There are times when they send some specimens to us, and we did some. And we have so far, if I may not be speaking under correction, out of the 16, should have tested 11 of them positive, 10 or 11, but I'm speaking under correction. But in total, there are 16 in the country. We have tested the majority of the positives.
Thank you. Second question? Come. State your name, please. Go to the mic. Thank you.
Hi, Jana Marie Smith from
Can you
Namibian
speak
Media
closer
Holdings.
to the mic? Thank you.
Dr. Hafiku, and then perhaps the NRP can also then answer. I'm just curious about the capacity but I think you said by the end of the month there will be a capacity to test between 20,000 to 30,000 people. Is that correct?
Maybe my colleague from the lab perhaps mentioned that. If he says that, then I'll believe it, because he's the one working in the lab.
Okay.
Yeah,
to Dr.
so
Fika-
it's all I can say to be very, very
Yeah.
good news to us, because capacity is one area. Yeah, please go ahead.
I think that's also what I wanted to know from you. Are you happy to know that that's the capacity you would have at the end of the month?
Absolutely.
And how
Well,
much of that would you want to be used as soon as possible?
Yeah, absolutely. The only thing is, when we say end of the month, we are basically saying in the next 2 weeks, unless if we say it's end of May. But what makes me happy is the fact that we have that capacity now to test, as we are hearing from the lab, because that has been one of our limiting factors. The reason why we had defined criteria for testing and only testing people that are symptomatic, not asymptomatic patients, is because we were actually worried that reagents and test kits will be running out and we couldn't test. So to have capacity is very good news to us.
And will the NIP continue to source the necessary materials to continue having the capacity over the next 6 months or more to continue testing a lot of people?
I think it's to him.
Yes,
Yeah.
sorry.
Yes, like I said, we have our reagents, consumables, and personal protective equipment. Some are on order, they're in the supply chain pipeline. And we are having some have confirmed estimated dates of arrival, some not yet. But according to our projection, we have placed these orders, and the expected dates of arrival or delivery is between this week and the 3rd week of this month.
Okay. While the next reporter journalist is getting ready, I would like to throw open a question, particularly to Mr. Makumbi. When is this testing, this countrywide testing, going to be rolled out? But more importantly, these laboratories in the rest of the country, are they equipped with the facilities to be able to test for the virus?
Yeah, like I said, when to roll out, by and large, will be determined by the direction from the ministry. In terms of preparedness, like I mentioned earlier, as we speak, each lab has a gene expert instrument with a capacity of testing 1 run, 4, 2, or 16. So in terms of equipment, they are equipped to start running as soon as we receive, of course, the reagents that goes together with that particular equipment. In terms of personnel, of course, in the outskirts, in our district labs, most of our labs are smaller ones, are manned by 1 or 2 or 3 persons at the most, very smaller labs. That we have also sketched out the possible number of personnel that we may need there. There are personnel which are non-technical, for example, data capturing. There are those who are actually should do the actual test. So we should be able to do the test because those technical people are already there. It's a matter of once those particular reagents are available, it's a matter of commissioning that particular instrument, training the particular scientist on site how to do the test, because for now, we should be able to have time before we roll out, do a test, by the way. There is installation of the instrument, verification of its performance, and then training of the user, and then you set up all the quality management system around that testing. So that we should be able to do within a couple of days as soon as we set up a site.
But Mr. Makumbi, the testing is centralized as of this moment.
Yes.
When are you going to decentralize it? And would that not be more effective?
Yes, decentralization is driven by the test volumes and the demand out there. So for example, for now, we are testing, we haven't reached 50 tests per day in Windhoek. So you can only decentralize as the demand shows you, indicates that you should decentralize. Like they were talking about the stage of the outbreak. So the more tests are requested, and from where they are requested, it indicates you or shows you where to decentralize, which one is the priority area. So as soon as we get all these indications, as the pandemic develops, we should be able to respond as quickly as possible to where we are first required to decentralize.
Yeah, just to add to that is that from the clinical case management point of view, we hope the process of decentralization is not going to take us long. Because if you look at countries that are overrun by the pandemic, they had a lag, they had a delay in setting up certain structures. And the moment that you want to make the lab in Katima functional, Katima is already overrun by a number of patients. We hope that, and we don't want that situation actually to happen. That's why we're really pushing that, like my colleague mentioned, that in those hotspot areas, we should have everything ready basically. A testing, at least in one, even if we don't put the machine or the reagent that day, at least we must have the whole thing ready. If the epidemic doesn't come the way we fear, then we dislodge our equipment, no problem. But it would be terrible if we have to struggle in the car tire based on the way taking a machine to Ashakachi. So that we obviously have to avoid by all means, that we have all the basics in place as long as they are safe. We set up our testing center and maybe even treatment center, because you can't just have testing center without treatment, because the two go hand in hand. For this reason, we discussed it even this morning. The Clinical Case Management and Infection Prevention and Control Committee, or PILA, is sending out a memo to all the regions to standardize our testing and treatment capacity. And we currently benchmarking on Robert Mugabe Clinic, which is our centralized center actually here for testing, apart from the unit in Windhoek Central Hospital. We see our colleagues in the region telling us we are ready. We have seen MBC going to other regions. But we need to go there from here to make sure that we are really ready. And what needs to be done must be done now during this window period, so that when the worst comes, which we hope will not come, at least we are ready. That's our message. Yeah.
Thank you, Doctor. Yes, you'd like to come up, please?
Good afternoon. My name is Shamaine Gashihewe. I'm a journalist with the Namibian newspaper. I have two questions. One for Dr. Haufiku. I wanted to find out the issue of the passengers who were stranded at the airport, I think about a month, 4 weeks ago. You went to assess the situation, Dr. Haufiku, and you let them go without basically asking them to quarantine or without ordering any form of mandatory quarantine. I wanted to find out, is there a way that the ministry is tracking them down since you were there at the airport with them? And then maybe, does that mean you would also need to undergo any testing? And then I wanted to find out, lockdown is another 2 weeks. Do you think it's enough time for us to contain the virus, that it doesn't spread to the community? Thank you.
Yeah. On the passengers that were stranded at the airport, I think we didn't really get the picture. That was one of the unfortunate, difficult situations we faced. First of all, let me just put it on record that 40 to 50 of the passengers from Deb Marine who were coming off the ship for the 14 or 28 days, they were quarantined. I haven't picked that up in any of the media. People concentrate on all other sort of things, but those Deb Marine passengers were taken for quarantine. And it's because it was arranged, they were informed before they landed at Hosea Kutako that they would be quarantined. It was just a matter of delay in terms of logistics. The difference of these patients gave us a very difficult situation. In fact, I thought, and I still believe that if we had not, or let me say I, because I'm the one who was there, if I had not told them, but I mean, I didn't just act out of my own thing, I act out of the situation. If we did not allow them, or I did not allow them to go home with the message to self-quarantine, we would have been in court almost that whole week. There were 2 Supreme Court judges or senior councillors who were already even trying to speak to the president of the country and asking, why are we here? The reason is not necessarily because of coronavirus. The reason is that they believe that they were treated unfairly because on that same plane that came from South Africa that day, a number of passengers were dropped at Walvis Bay Airport, including some of the crew members. Nothing was done. Nobody said you are going to be quarantined or anything like that. So when they landed here, they were told by Air Namibia or official at the airport that 1 or 2 planes already landed before their plane. We didn't quarantine them. We didn't ask anything. So they were asking, why us? Why do you want to quarantine us and you did not quarantine the other plane that landed in the morning? And that same day, I received about 40 passengers, Namibian passengers who came in from Amsterdam with KLM. It was well arranged. Everybody knew. We went there with Ms. Masabane. We talked to them. They were escorted to Marienda, happy, very happy. So this is a very unfortunate situation that came up, and we had to let them home for self-quarantine on technical basis, and it's a mistake. It's clearly a mistake. And I think it has to do with the way we communicated with the airline, because even Air Namibia was apparently not even aware that the quarantining of anyone coming from outside has already taken place. They had a letter, which I have seen, telling everyone that on the 28th of March, we'll suspend all the flights. So clearly, even Air Namibia was under the impression that they can still operate without any quarantining of passengers. It's a terrible miscommunication, actually. But yes, those people are in the community. I am just hoping that it did not cause any community transmission that we are talking about here. A number of them, we gave them the call number if they developed symptoms. First of all, we told them, because I was not alone, I was with the public health official. We told them, you go home, you isolate yourself for 2 weeks, you don't make contact, all the preventive measures that we're talking about, and you must phone this number if you develop any of these symptoms. Well, we can only hope that maybe majority or all of them did not develop these symptoms. But I agree that was not the right thing to do. But we were under duress. We could not do otherwise. I'm just glad that no such situation was reported after this. And now, part of testing to check if community transmission is taking place is also to include all those people who were in the country without quarantine. And they are not the only one. Cars were coming in here from Noor Uber. You know, some South African apparently saying we want to spend the lockdown in Namibia. So we were not locking them down. That's very unfortunate. And that's why we need to be suspicious of community transmission. And we need to be aggressive in testing and trying to see if we pick these cases up. I hope I answer your question. You ask if there is enough. I probably forgot that what you say. If there is enough.
Second part of your question?
If there is enough. Whether 2 weeks is enough. Oh, sorry, I probably talked too much. I apologize for that.
Okay, Dr. Haufiku, before I get to that second question,
Yeah.
I wanted to find out whether you would also be eligible to be tested.
Those that,
Because you were at the airport as well.
those who were
Yeah.
at the airport.
You, because you were there.
And
okay.
I gave you my result the other day, guys, you know.
Okay, my second question.
But you see, the test of one individual is only good to protect you. I'm just one of those. Yes, I went for the test.
Okay.
And my result are at the laboratory. You can ask the gentleman here, he will. But it doesn't absolve me from the risk. I'm with you here, I'm in the society. So I have to be careful all the time.
Okay, my second question was, is
Yeah.
2 weeks enough time?
Sorry?
To, whether the 2 weeks, the extended 2 weeks for the lockdown,
Yeah.
is enough time to contain the virus from spreading to the community?
Maybe not entirely, but it's something much better than not locking down at all. If you look at the graph from the Department of Health in South Africa, and I know Professor Karim Abdul Karim, or Salim Abdul Karim, and Mr. Pillay, who did this modeling, very, very outstanding scientists. If you look at two of those slides, and they compare them very well, the slide that shows or model a lockdown for just about a week or so, show the curve slightly flat, but not that much. The moment you extend the lockdown, then the flattening of the curve stayed very low. The moment you hypothetically lift that lockdown, then you got an exponential growth of cases. These are scientific data. It can only give us one conclusion, that locking down does intercept transmission of the virus in the community. Perhaps not for good, but at least for a period that gives you a window of some kind of preparation, strengthening your mechanism, etc., etc. It does have an effect, a positive effect, yes.
Thank you very much.
Well, all that I can say is that from WHO, we continue to support countries, in this case Namibia, by providing technical information, technical advice, and particular in how to contain the outbreak. So there are different teams that are addressing issues of well-coordinated response, issues that are guiding the government and the ministry on what are the accredited or approved treatment or supportive care modalities available, and issues on risk communication. So we are really requesting that communities trust their government, the Ministry of Health, information sharing, and also from WHO as a source of credible and trustworthy information databases, rather than relying on the media, the social media. Some of the information really is really misleading. So with that, I think let's continue to know where to get the accurate and correct information from government and WHO. Thank you.
Thank you. Thank you. Mr. Makumbi?
Thank you. Yeah, in terms of testing preparedness, our finger is on the pulse. We are prepared. We continue to prepare, even for the worst case scenario. We are preparing to roll out if there's a need to roll out. At the moment, it's centralized. We have a transport logistics system for the specimen movement from the point of collection to us, in partnership, of course, with our national courier, NAMPOST, which we use to transport all other specimens from points of collection to central testing in Windhoek. So we are ready together, directed by the ministry. We are in one team. We are in communication, and as soon as there are particular indications for testing or particular special advices, by the way, we are also advised by the CDC. In country is part of our team as well. So we are moving towards reaching at least that point of preparedness even though under limited resource settings, you cannot reach a very desired point to say you are completely prepared, but we are prepared. Thank you.
Okay. Dr. Afiku.
I think we are doing not too bad. We are doing well according to the available data that we have. I mean, you can go to the Johns Hopkins University and check how many countries are staying up to 10 days, almost 2 weeks, without picking up a case. That's a good sign. 16 cases, also a good sign, because we are about 2 months now. We just have to do more. We need to do more testing to back up our cases with robust data. So testing, we need to test. We need to continue with all these measures. Social distancing, all the measures, including the obeying of the lockdown, because lockdown means intercepting transmission or possible transmission from one region to the next, and mostly to the vulnerable. I plead for discipline among our people, that if there is a roadblock there, it's not there to recolonize you. It's actually there to maintain order and to make sure that, as inconvenient as it is for all of us to stay in one place, Namibians are normally mobile population, but for the sake of this pandemic, for the sake of all of us in Namibia, let's follow the regulations, the rules, the disciplines, the guidelines, and help each other. Help each other. The one who doesn't understand, or the one who hasn't got access to something, then we'll pass through this pandemic. I am quite optimistic that if we do the right thing at the right time with the right people, we'll get the right results. So that's my conclusion on it.
Thank you. Yes, and as we've heard, at 16 cases, Namibia is doing relatively well. However, we cannot be complacent. So you need to follow the health directives. We need to obey the regulations around the lockdown, and you need to remain healthy. From all of us, it's thank you, and I'd like to thank the panelists as well. Thank you very much for informing the nation and for the good job that you're obviously doing. From all of us here, it's goodbye.
Thank you. Thank you.